afternoon and welcome to Medicine in Our Backyard. This series is presented by the Newport Beach Public Library Foundation in partnership with UCI Health. My name is Adrienne Windsor and I am a board member of the foundation and very pleased to be welcoming you this afternoon. We would like to thank our generous sponsors, Mike and Polly Smith. Mike and Polly initiated this program several years ago. They have been sustaining donors throughout the last few years, and they have empowered us to bring the latest research from UCI into our community. This program is going to conclude today with a Q&A session, so we request that you hold all questions until the end of the lecture. Please use the Q&A box to ask any questions instead of the chat box. I'm pleased to introduce today our speaker, Dr. Rami Khayat. Dr. Rami Khayat is a board-certified UCI Health pulmonologist who is nationally recognized as an expert in sleep-disoriented breathing. He is affiliated with the UCI Health, Sleep Medicine, and Pulmonary Medicine and Critical Care Services. He earned his medical degree from Tashreem University in Syria. He completed an internal medicine residency at the Medical College of Wisconsin in Milwaukee, followed by a pulmonary and critical care fellowship and sleep medicine fellowship at the University of Wisconsin School of Medicine and Public Health in Madison. He's going to speak to us today about sleep during COVID. And if you've had sleepless nights, and I know many of us have, this is a welcome opportunity for us to learn more about it. So Dr. Rami Khayat, welcome, and we look forward to your presentation.
Good evening, everyone, and thank you very much for having me. I hope I think I am unmuted. I will share my screen. Let me do that here. So I was asked to speak about sleep and its impact, the impact of the current pandemic, and our sleep impact on our coping with the pandemic. So I will be speaking for about 25-30 minutes, and then hopefully we'll have a good period of time for Q&A. I will start with an overview of the role of sleep in health, and then some of the consequences of decreased sleep time and quality on our ability to cope with disease, and then discuss towards the end the impact of the recent pandemic on our sleep and as it pertains to our general health. So couple basics about sleep that are important for, see if this is I guess I should put this on slideshow, sorry about that. People may know this, and these days our watches are teaching us this on a regular basis, but our sleep consists of a transition across certain sleep stages. They're roughly divided as non-REM sleep, non-rapid eye movement sleep, and rapid eye movement sleep. Sometimes your watch may tell you it's active, deep, or something like that, but REM sleep is this here in these dark bars, and that is the stage during which we are pretty much paralyzed. Our muscles are extremely relaxed, but we do experience bursts of activity the last few seconds, and then we return back to this very decreased muscle tone. Our sleep, all the human and mammal sleep, consists of this transition across stages. So we call these sleep cycles. Each cycle consists of, stage 1, 2, 3, and then REM sleep. 1, 2, 3, REM sleep, 1, 2, 3. It is very well choreographed. Normal sleep should allow us about 4 periods of REM sleep, sometimes 5 depending, but it should not be less than REM than this number of cycles. But what's important is beyond the sleep cycles themselves is the impact of these cycles on all body function. So for example, during non-REM sleep or that stage 1, 2, and 3, as we transition into deeper sleep, our heart rate goes down, cardiac output, which is the work of the heart muscle, the blood pressure, the blood vessels dilate and relax. So all these changes serve multiple purposes, including decreasing the blood flow and pressure that arrives at the level of our brains, hearts, and kidneys. These are the vital organs. So these organs get to work a little less and rest so they can last us longer. Then there are periods of processing where the blood pressure may temporarily increase and then return back. And these are not really clear what their role in our overall health, but that they are signs of health. So having these occasional surges in blood pressure and heart rate is normal, but we are programmed to experience a decrease in blood pressure exposure for a good 8 hours or 1/3 of the day so that our organs can rest. Along with that comes numerous changes in hormones. When we go to sleep, certain hormones decrease, certain hormones increase. In the morning when we wake up, some hormones pick up. So cortisol comes on in the morning, decreases towards the evening. Insulin has a certain pattern, growth hormone, thyroid function. So sleep is just critical for choreographing all these functions. And whenever we approach our sleep, we should think of it from that standpoint. It's not just about resting the body. It is about every single cell in the body needs this period. And I will dive into this a little bit more, but I want to just show you something here specific to the blood pressure. Blood pressure is one of the most important public health issues, despite all what we're dealing with right now. In one study, researchers took about 6,000 individuals and did sleep studies on them and looked at their subsequent risk of developing blood pressure. Those individuals who slept less than 6 hours in this area here, if you can see, and there are individuals who slept 7 to 8 and 8 to 9. The individuals who slept less than 6 hours had almost twice the risk of developing high blood pressure or hypertension over a period of follow-up compared to those who slept normally 7 to 8 or 8 to 9 hours of sleep. And those who look at data and statistics amongst the audience should know too that these comparisons were adjusted for risk factors of blood pressure. So short sleep time is associated with risk of developing hypertension, even after we adjust for all known risks of developing hypertension, such as family history, alcohol intake, weight, and other things. Other important considerations for sleep is you do pay the price for decreased sleep immediately. It doesn't have to be developing hypertension after a period of several years. So in this, and I apologize for the graphs, but I always thought they're a lot better than me just listing these things in sentences. But if you look at the brown graph here in the bottom and look at the scarlet or reddish thing here and that I'm pointing to with my mouse. So if an individual sleeps 8 hours, spend 8 hours time in bed, TIB, we woke him up in the morning and we had to measure. I don't know if any of you has had this test when you go to look for visual field and they ask you to push a button every time a light flashes. So this is a test of alertness and focus. And this test, we call it PVT, is used sometimes in the military for pilots, for people who require a lot of attention to measure their ability to handle the demands of their job. So when we sleep 8 hours, or these individuals sleep 8 hours, they had no lapses. They don't miss any light. They'll push the button on every single light. When we sleep 4 hours, there are significant increase in the amount of lapses, that the decreased reaction time and alertness and executive function becomes very visible at 4-hour sleep decrease. And 6 hours is in between. So we really do manifest that immediately the following morning, basically. Another thing that is a major impact of sleep, and I think maybe some of you are familiar with all these natural disasters. Many disasters, flight issues, aside from the car accidents, but things like the Exxon Valdez, that the chemical leak in India, all these major things were linked to decreased sleep or sleepiness, or these human errors that often get blamed for these types of disasters. In one landmark study from 1997, the investigators took individuals and kept them awake. So after 17 to 20 hours, 21 hours of continuous wakefulness, they had them perform again some tests to measure their alertness, and they compared their performance to individuals who had 0.08 milligram per deciliter of alcohol, which is what we call the legal limit. And their performance was very similar to individuals. This is the area here. The individuals who had that much alcohol level performed poorly in these cognitive testing as much as those who stayed awake, 17 to 21 hours. So it is really very palpable, the impact of decreased sleep. We feel it right away. It affects our performance. A lot of people maybe are in denial, but it is not something that it can happen to you on a day-to-day basis and not notice it. Other important functions of sleep that are relevant to what we're dealing with these days, memory on top here, and immunity. So there are certain functions for memory. So for example, when we talk to our kids about sleep and sleep time and the effect of that on their academic performance, the ability to acquire information and transition it into from stimulus to an actual memory that stays in the brain is proportionate to the degree of alertness, and the degree of alertness is proportionate or is a consequence or a function of how much sleep the person had just the night before. Importantly, the night following acquiring the information is a night where, and this has really been discovered relatively recently, people suspected that sleep is important for consolidation, but the brain kind of goes to work during our sleep and transfers a lot of these acquired memories from short-term to long-term memories. So many of these bits of information that we acquire during the day may be lost if we didn't engage into deep, meaningful, and healthy sleep the following night, or even 2 or 3 nights following that. The ability to recall after we even acquired the information and shelved it and stored it and turned it into long-term memories, it doesn't come to us when we need it if we weren't alert during the need for recalling the memory. So it's critical to the function of memory. Of course, many of you are aware that decreased sleep time is increasingly now linked to cognitive impairment and memory in older adults and dementia in older adults. Similarly, the same immune system memory is linked to the amount of sleep we have. So the ability to transfer the information we acquire from being exposed to pathogens, to bacteria and viruses, into readily deployable responses to subsequent exposures is also related to our sleep time and how much, especially what we call slow wave sleep or non-REM sleep, we experience. I'm going to show you an example of this to just emphasize this particular point. In one experiment, investigators took about 160 healthy subjects and measured their sleep time over a 7-day period using this device called actigraphy, which is again similar to these watches that we all carry now and can measure our sleep time, but it is medical grade and much more accurate. They had these individuals isolated from any other exposure, and the only exposure they offered them was the exposure to rhinovirus, which is the virus that causes the common cold. So they took it and dropped it in their noses during this period of this research experiment, and monitored them for 5 days, and looked at the relationship between their sleep pattern and their risk of acquiring a disease or illness. Obviously we all encounter viruses over the course of the day, but some of us fall sick with them and some of us don't. What the investigators found is that, and if you look here at this bar, this is less than 5 hours of sleep per night on average, and this is more than 7 hours. And this is the risk of manifesting cold. So putting the virus in the nose doesn't necessarily become illness if the individual slept well and was able to fight the infection. However, in individuals who had less sleep, they were more likely to manifest cold symptoms and allow the virus to reproduce and create respiratory illness. This obviously has been repeated. You may have heard about it in relation to influenza and other respiratory illnesses. And many now we're learning a lot more, obviously, about the coronavirus, and many believe that similar pattern occurs with any respiratory virus. We know that sleep loss impairs our ability to produce inflammatory markers that fight pathogens that make it into our blood and our mucosal membranes. If we were given the influenza vaccine, for example, and were sleep deprived after it for a few nights, for one reason or the other, the immune response that we mount will be decreased. If someone is was sleep deprived for a day or two, they produce harmful inflammatory markers like this C-reactive protein, which we often now use it to measure the severity of COVID in patients who are affected by it. Again, I'm not saying if someone is sleep deprived, they will just create COVID and get sick with it, but it is clearly going to impair their ability to fight any exposure to any pathogen, specifically respiratory viruses. Other important and known and established health risks of chronic sleep loss, and I'll talk to you in a little bit about what that means, but in general, that is someone who sleeps less than they need to for a long period of time. And again, the people who do that are higher risk of falling ill when they're exposed to pathogens, from kids and grandkids and colleagues at work and such. They mount less response, as I mentioned. They're more likely to manifest, to acquire depression. And if they were in the process of being treated for depression, their depression may be much more resistant. Their depression may cause more manifestations in the sense of suicidal ideations. Clearly, sleep loss and sleep restriction are linked to several cardiovascular disorders, including hypertension, as I showed earlier, but also myocardial infarction, stroke, coronary events, and other things. And this is aside from having sleep apnea or any of these other important sleep disorders, just the sleep loss itself or sleep restriction. Metabolic syndrome is a very it's an emerging area of interest for us in the sleep medicine field. When we restrict people's sleep, their appetite increases, and several hormones that can promote obesity get increased. So often, professionals who work in jobs that require them to do night shift end up sleeping less. They eat more. They develop more obesity and develop more diabetes. A very strong link between sleep loss and dementia. And another area of emerging relationship with sleep is individuals who are trying to fight cancer, but they're dealing with sleep abnormalities and sleep restriction for various reasons, are likely to have poorer outcome. Of course, job performance and accidents are a well-known consequence of this. I'm going to show you another kind of less mentioned consequence of sleep loss, but it is important for those who deal with chronic illnesses that bring pain, arthritic pain, back pain, neurologic pain, or neuropathic pain, or other factors. is this is kind of an experimental, what we call the pain threshold. So if you expose someone to pain and see how fast they pull out their finger from that exposure. And in these experiments, they had individuals sleep 8 hours, 4 hours, or no sleep. And or they selectively deprived them from REM sleep versus non-REM sleep. And what the investigators found is, one, is that if you sleep 4 hours versus 8 hours, our pain threshold is so much lower. It takes very little pain to for us to feel it. And we do deal with this in our practice here. The UCI Sleep Disorder Center is we do see a lot of chronic pain problems, but when they sleep less, they're requiring significant amount of pain medication, for example. And ability to cope with their disorder is much more impaired. To talk a little bit about causes of sleepiness, if someone is feeling sleepy, number one, I will say this is not normal. We do see a lot of individuals who come to our clinics and say, it's normal, I'm getting older, I'm dealing with a lot. It is not okay, and it's not normal to deal with sleepiness. And I will, hopefully you'll find this helpful when you approach your own health and examine your sleep. Is the first thing you ask is, am I sleepy because I'm not sleeping enough? And I will tell you in a minute what that means, what the number of sleep hours should be. But that is a very common problem in modern life, is most people aren't really sleeping long enough. If you stop here and look at how much sleep are you getting, between 7 to 9 hours of sleep, then you are sleeping long enough. If you're sleeping long enough and you're still sleepy, then maybe your sleep quality is impaired. And that means maybe you have a sleep disorder, such as sleep apnea, insomnia, restless legs, other abnormalities. Maybe there's a medical illness, chronic medical illness that affects your sleep quality. Maybe there is a mood disorder, psychiatric illness like depression, anxiety disorder that impairs the mood. Of course, people deal with transient stress and such that are factors in impairing sleep, and they're often, obvious to us. There are factors that are sometimes self-imposed: excessive caffeine intake, alcohol intake, noisy bed partner, caregiving responsibilities. We're taking care of a sick family member, so we're waking up a lot, travel, shift work, other things. So, but again, if you approach your own health, think about this way: am I obtaining long enough sleep? And if I am, and I still am sleepy or waking up not refreshed, is there something wrong with the quality of my sleep? And could it be one of these things: a sleep problem, medical problem, psychiatric problem, or extrinsic factors, environmental factors? And here's the sleep duration. So the sleep requirement does drop with age. And I will say, since it'd be safe to guess that most of the audience now are adults and not in the range of the infant and toddler, but we all do take care of kids and grandkids at home. So we should know too that 14 to 17 for a newborn, all the way to school age 9 to 11, which is often an argument you'll have with the kids and grandkids that they do need this much sleep. Teenagers also need up to 10 hours, and that's the major area here right now of deficiency. Rarely a teenager is getting 10 hours of sleep these days. And really, throughout the rest of our lives, it's 7 to 9, 7 to 8. It's presumed that the older we get, the less sleep we need. And it is possible that someone here and there may get away with 6 hours of sleep, but the vast majority of us need at least 7 to 8 and generally 7 to 9 hours of sleep. So how are we faring? Over the past several generations, and I will draw your attention to this area here, these are surveys that the National Sleep Foundation, or this one was a Gallup survey, I apologize, comparing 1942 to 2013 sleep time. If you look here in the 40s and 50s and 60s, presumably, the number of adults who obtain 7 hours, 8 hours, and 9 hours or more, probably these are the percentages, constitute about 85, 90% of everyone was sleeping between 7 and 9. Now in this area here, it's about 60% of adults are getting 7 to 9 hours of sleep, and it's getting worse. This is even when before smartphones became this crazy available. So I would venture to say, and a lot of the newer surveys are showing us that a lot less people are obtaining 7 or 8 hours of sleep. In 2013, 43% of Americans were reporting that they never really get a good night's sleep, for various reasons. 60% of adults were reporting that they have some form of sleep problem. And the National Highway Traffic Safety Administration was reporting that, and it's an estimate that more than 100,000 automobile accidents were related to drivers falling asleep. Now, this is falling asleep is an extreme case. Being sleepy is something that is very difficult to pin down. Most investigators in this area think that majority of automobile accidents are related to either using smart devices or sleepiness or being sleepy. I'll leave you with this to see what a lot of people who are making important decisions for us are often making it while sleepy. And I just showed you how much lapses in judgment and memory and recall we have when we are like this. So to wrap up to this point is, sleep is important for our immune system, for our cardiovascular system. Increasingly in the past 10 years, we're all sleeping less than what we need. And I am not done yet, if I may. I have just a few more minutes. I see Adrian just came on to come up with some questions, but I was gonna tell you about the impact of COVID. So when COVID hit, on the background of what we're dealing with, we are watching the news, we are staying up late, waking up at night to check on what happened. I can't really tell you enough, and I'm not going to bring a post-traumatic stress disorder here to everyone by showing you all this, but I'm summarizing it a little bit in this graph so you know. The impact resulted in isolation from family and support system, disruption of normal routine, eating habits changed. People sat at home and started eating more, additional meals, anxiety, worry, family, work stress, excessive screen time, sleep time decreased, exercise decreased. We are seeing more and more people come into our clinics complaining of decompensated depression, blood pressure out of control, immune system, even flare-up of chronic diseases, arrhythmia, people drinking more alcohol and gaining weight, getting more sleep apnea. So the health of the population has decreased significantly, indirectly, not even just the ones who were affected by COVID, it's everyone else. To add insult to injury here, increasingly, investigators are finding links between having untreated sleep apnea, for example, or untreated insomnia, and actually risk of dying from COVID. In the ICU, I'm an ICU physician as well as sleep physician. When I walk at the UCI ICU, during the past few surges, a lot of the patients, and I will end up seeing those sort of ones who survived that critical illness in clinic, had sleep apnea, and the ones who fared very poorly seem to have untreated sleep apnea. And that's just one sleep disorder that seems to play an important role once one acquires COVID. I'm gonna leave this slide up as I take questions and answers here, so people can ask me about it, but these are general recommendations for sleep hygiene and improving our sleep quality. And I will stop here so that I can participate in questions and answers. And I think, I don't know if Adrian has some of this.
So thank you very much, Dr. Khayat. This is quite a lesson to all of us that we need to get our rest, but COVID has caused so much disruption in our life and in our schedules. what if you're lying awake all night and not able to go to sleep? Is it good if you're at least resting?
Yeah, as far as insomnia, sometimes we hit these spots once in a while where if this is a problem that happens every night, then it's an issue that requires some attention. If it is a transient problem, we sometimes approach it by asking the individual to actually give it 20-30 minutes and then get out of bed and sit in a relaxing environment, like maybe in a chair, read a book, feel their body getting sleepy and tired, and then getting back to bed and try again. And if they tried that several times and they can't fall asleep, it is okay then to stay in bed and get your body rest. But it is helpful for once or twice, if you're not able to fall asleep, to not fight yourself trying to fall asleep, rather get out of bed and sit in a chair and get yourself to feel your body being sleepy before you go back to bed.
Well, that's very helpful to know. It's better to get up and do something and then try to go back to sleep than agonize over it.
Yeah.
Now we have a question here. Although recommended to get 7 to 9 hours sleep, I have found that I'm awake after 6 hours. That said, can one make up for the lost night's sleep with a daytime nap?
Yeah, that's a very good question. And I think, I will say some people, especially, older adults, it is very reasonable to do, for example, to get 6 hours at night and 1 hour nap, or 6.5 and half an hour nap. It is, if you can, if the total sleep time adds up to about 7 hours, then that's fine. You're getting enough sleep. That's one thing I wanted to say. Another thing about that is if you're not getting enough sleep at night, and during the people have long commutes, they have busy schedule, they get to bed 11, 12, wake up at 6 to drive to work, and they think they can make it up on the weekend, that's really not good. You really need to try to pay your sleep debt as soon as you can. Because number one, you're suffering immediately from being sleep deprived or sleep restricted. And also you can never possibly, if you accrue 1 hour of sleep debt every night, then you have about 5 hours to pay, to sleep in. And we never really sleep 5 hours on Saturday or Sunday. We sleep in by an hour or two. So we're always short on sleep. But to wrap it up, if you can add a nap, that's a good thing. All the power to you. It's very helpful.
That's good. So we have another question here. I had acid reflux, woke up with coughing since the pandemic at midnight. How do I prevent it?
Yeah. So, there are multiple explanations to this. Unfortunately, I can't get more history from you. But what I was referring to here quickly, that people are eating more and eating late and drinking alcohol late. So assuming you were able to not take anything, 2-3 hours before bedtime, it is ideal that we stop eating about, minimum of 2 hours before bedtime. And let's say you elevate the head of the bed a little bit to minimize that reflux. But if it is a common problem, you probably have to take a reflux medicine or, talk to your doctor about it. But what I've seen often is most people, if you stop eating or the last meal was about farther than 2 hours, maybe 3 hours before bedtime, and no alcohol very close to bedtime, most of the reflux issues get resolved on their own.
Oh, good. Thank you. We have someone here who's a side sleeper and would like to sleep on her back, but she has a difficult time falling asleep on her back. So do you have any recommendations?
Yeah, it's a good question because sometimes there are reasons for this. Let's say if it's not back or shoulder or something like that forces her to sleep on her side, and she can physically actually lie on her back but cannot fall asleep. Sometimes it is because of sleep apnea, because sleep apnea is worse on our back. And as soon as we drift to sleep, we feel like the windpipe is closing up a little bit and we immediately wake up. And sometimes we can't even settle to go to sleep in that way. So if she wants to be seen and talk to her doctor about it is one thing. If not, one option is to elevate the head of the bed a little bit. And sometimes we recommend you get a wedge or elevate the whole head of the bed, not just elevate the head with pillows, because sometimes when we use pillows, we bend our neck. But should I stop sharing here, or Adrian, or?
No,
It's okay. Yeah. So sometimes the pillows bend our neck, and ideally we want the whole body to be elevated by like 30 degrees or so. So we tell people use a wedge and see if that helps you fall asleep on your back.
Okay, thank you. Another question here. How common is it to wake after the first sleep cycle and have trouble getting back to sleep? Is that problematic? Is that common?
Yeah, we experience brief awakening, every hour of sleep. We don't really remember them, and we don't think about them. And often, to your point, Adrian, you were saying about someone who lies down and they don't sleep all night long. Most people actually do fall asleep, but they don't remember that they fell asleep in between. Sometimes we get used to the fact that we're waking up at a certain time of the night, and then we get anxious about it. And that maybe is what the question refers to, is waking up and not being able to go to sleep. It is not very common. There's often something that's causing this. And I would recommend, if it's only at that point, after maybe an hour and a half of sleep, perhaps, you can get out of bed, go to the restroom, come back, get situated, and start your sleep again. And see. And if that's a one-time deal, it's fine. You can, if you're sleeping 7 hours at night and you woke up once or twice, that's not really the end of the world. It's fine. You're still getting enough sleep. You're getting your 7 hours minus these awakenings. It's still okay. So don't get too worried about it if you're able to go back to sleep. If you're not able to go back to sleep, then it's a problem, and there's gotta be some explanation for it. I would say you can try to get yourself resituated and try to go back to sleep. If you couldn't, you should probably talk to your doctor about it. Maybe you have a sleep problem like sleep apnea or, restless legs or something like that.
So how would we know if we need to come to your clinic and see you?
Yeah, I would say one of the most important indicators is the way you feel in the morning and later in the day. If you wake up, relatively refreshed, able to take on the day, and you look back and you know that you were in bed for 7 to 9 hours, and you're not falling asleep driving, that means, and not necessarily falling asleep driving like in a serious way, but you're able to get your work done, you're coming back at 5 or 6 and not too sleepy, and no one in your family is saying, you're falling asleep watching TV, we can't talk to you, you don't have energy to do anything. If you have energy, you're getting your work done, you're meeting the professional and family and social demands and all that, then you're fine. Now, if you wake up a lot at night and you consistently wake up feeling sleepy, or sometime in the early afternoon or the early evening, you just can't get going, you can't do things, then you really need to talk to us or to your primary doctor about it. It's not normal to feel sleepy and dragging every day. So look at the quantity of your sleep first, then start judging the quality of your sleep, and look at how you feel during the day. If there are periods of time consistently where you should be in function, or your loved ones or colleagues at work are telling you, look, you're just not, you're tired, you don't have the energy to do certain things, then you do need to talk to us. Yes.
I'm a student of the late Buckminster Fuller, and he slept about 4 hours a night, and he said that he pushed back the amount of sleep that he needed by cutting back a half hour at a time until his body became used to it. Is this something that really people can do, or was that just unique to him?
Yeah, I've been, been in this, sleep business for like 20 years, sleep practice, and I've known a lot of people who, now, that's probably unique to him is the short answer, but this does come up in my practice right now here. I've been, and by the way, to all the audience, we are in Newport Beach. We're on Birch Street, so people know we're close to you. But I've been in this practice here, came from Ohio State University for about a year and a half. I have only one patient who I believe that, genuinely is getting by on 6 hours of sleep, but everyone else, I don't think so. Most people we tested over the years tended to kind of get micro naps, we call it. They get one sleep period, maybe 4 or 5 hours, but then during the day, they take mini naps here and there. And I've known a lot of individuals, professionals, executives, physicians, scientists who say they do that. Sometimes we study them and we find they're getting probably 6 hours at night and, a few half hours or 15 minutes here and there. So it is very unique, but it is true. Some people are genetically engineered to be able to get by on short amount of sleep, but that's not the rest of us. So let's not try it. Don't think you can even, I think he probably was genetically predisposed to this. Most of us aren't able to do this.
Not able to do it.
Yeah.
I noticed the graphs you had for teenagers and adults 18 to 25. These are periods when there is, I think, tremendous sleep deprivation, especially with video games now during the COVID-19 and kids at home. And then as a college student, the all-nighters that students pull. What do you do about that?
Yeah, that is very, and it is, sorry about that. It is very, it's a major problem. Even before the explosion of the electronics and COVID and home or internet schooling and all that, about 25% of adolescents had what we call delayed sleep phase. They don't fall asleep before 1 or 2 in the morning, and then they're forced to get up at 8 or 7 to go to school, and they're chronically sleep deprived. They have enough reserve, and then they're sleeping in on the weekend. And now this thing permeated the all the age groups. Really everyone is bringing their electronic to bed and working on it and putting it down and then waking up and doing it. And we try. There is really it's going to come from individuals. People have to recognize this. A lot of people are more and more sleep deprived or sleep restricted across age groups. I would say for parents or grandparents, you have to have the conversations and you have to be consistent. And increasingly, we have to set the example too. Sometimes our kids are looking to us and seeing us sitting there on our phones too. And we're saying, well, I'm doing something important, but it is, and they're doing something important to them too. So, we do have to, you can schedule time, you've heard about some families, scheduling dinner time or requiring the kids. I require my kids to put it down at, 11 o'clock. My son puts his phone, and it's a struggle, but we ask him to put the phone down in our bedroom at 11 o'clock and pick it up in the morning so he can get some sleep. So it's a struggle, basically, is all what I can say. And no one is winning it as far as I know. And I don't know of any winning formula really, but I know that we shouldn't give up because it is not good and it's not right. And we're not engineered, beyond the short sleep time. It's the stimulation. It increases anxiety, decreases attention span, causes learning impairment for people. People are even unable to acquire, there are studies showing we don't have the wingspan or breadth to actually read a 5-page article anymore. Everyone is, the era of electronics. So it's a big problem.
It is. I have someone here who has nightmares.
Yeah.
What about nightmares and what do they do to our quality of sleep?
Yeah, so nightmares are not always a problem, but a lot of things happen during the dreaming stage. So a lot of sleep disorders, like especially sleep apnea. So Sometimes if you wake up, if someone is sleeping only, and I showed the sleep cycles, if you set the alarm where you're sleeping after 6 hours of sleep only, then you're gonna wake up during the dreaming stage and you'll remember your dreams. And you'll have excessive dreaming and potentially nightmares. So then make sure you're sleeping long enough. Sometimes, if it's an occasional nightmare, it's normal. If it's happening consistently and it's bothersome, then we do need to see you and try to dig into the causes of this. Sometimes it is, depression can do this, trauma, stress, sleep apnea, medications, alcohol close to bedtime, certain sleep habits can do this. For example, exposure to TV and electronics close to bedtime can do this. So, but I would say an occasional nightmare is expected. I can't give you a number to that. We don't really know what's normal, but we all dream every night. Most of these dreams we don't remember. Once in a while, we'll remember them. So that is okay, so long as you're not sleepy and having other symptoms.
And oftentimes I find I have dreams that I'm so glad when I wake up and it was a dream.
Yes. Yep. Some dreams are meant to stay there. Yep.
Exactly. I noticed that you are also in the Department of Psychiatry. Our psychological state, I assume, has a tremendous amount of affinity with the way we sleep. Do you, for instance, recommend meditation?
Yeah, sleep is, it's linked to medical illness, psychiatric illness, psychiatric state, sense of well-being. Like I said, half an hour to 1 hour decreased sleep time makes us nervous, anxious, making sometimes rash decisions, short-winded with colleagues and loved ones, and so it's a big deal. Meditation is, and I've done some work in this area, has great impact on the quality of sleep, especially like the mindfulness based stress reduction and these types of interventions. Very helpful for sleep, very helpful for our coping abilities during the day. Some of the biofeedback techniques are very helpful for our blood pressure. But beyond that, your question, Adrian, about psychiatry and sleep, I've been really, and I, like I said, I've been doing sleep medicine for a very long time, and I learned a lot actually because sleep here in UCI is joined or under psychiatry, and we are seeing the impact of sleep restriction and sleep disorders on individuals' ability to cope with variety of psychiatric disorders, be it depression, bipolar, and the impact of insomnia and all that on medical illness. So it's extremely linked, and we try here to have this type of comprehensive approach to to these disorders. But mindfulness is highly recommended. Yes.
All right. Well, thank you, Dr. Khayat. It's been very helpful. I think most of these questions that we've had here from you today have to do with disrupted sleep, with waking up in the middle of the night. Just to be told that it's the collective amount of sleep that you have during the day that's the most important thing, so that we can perhaps all find ways to compensate for the sleepless night by taking a nap the next day.
Thank you. Yeah.
With us, and stay well. And I hope our audience will get their sleep so that their immune systems will be much stronger. Thank you so much.
Thank you very much. Thank you for having me.